I rise to oppose the bill for a long host of reasons. Chairing the Health Committee, we are faced constantly in the state and this legislature with trying to always come to better health for people, better ways to get that health, a better relief from pain when people are ill or hurt. And so I don't look on this effort mildly, because it's an incredible step for a state legislature, even though others have done it, to start declaring what is a safe drug, how that drug can be administered, even to set up its own labeling, notwithstanding the fact there is no labeling by the FDA. It's the medical model that disturbs me the most, because it tries to make it look like the model that exists in the United States that we have for medicine and for the treatment of medical illness. But it's not. It's not, because the steps aren't there. I looked at a lot of the literature as to how a drug gets approved in this nation, looking at the animal testing that has to go on, applications setting forth the human test that would have to take place, phase 1 studies for human testing for safety, phase 2 studies for human testing, phase 3 studies for human testing. Now you're up to about 3,000 people. Review of what you've done with the FDA. Submission of further plans to do this. Review of the pros and cons of the nature of the drug. Coming up with a formula as to the label, as to when it may be safe and may not be safe. These are very elaborate processes. Many times they're criticized, but many times people feel they're absolutely necessary for the protection of the people who are patients and for their families. That's what we have as an actual model in the United States. For us to try to imitate that, I feel no matter how close you get, you're just not going to get there. Certainly this proposal here is better than it was at the beginning of the year and far better than it was in years past, but it still does not achieve getting there. It talks about having in the bill that the physician will recommend the form and nature of the medical marijuana. Based on what? Based on what evidence? Based on what clinical trials? Based on what results? Peer-reviewed clinical trials. That's the norm in America. We don't have that. There's another provision of the bill says the physician shall recommend the length of time that a person shall have marijuana. Based on what? How does the physician know? How is that a reliable type of recommendation? If it's too short, if it's too long, is a physician going to be subject to professional liability? These things just don't work. Let me go to the question of the bill itself, because I have a real problem with the nature of the way it's defined as a serious condition and when medical marijuana may be used. It's in Section 7 on page 3 of the bill, beginning in line 21. It talks about the following severe, debilitating, or life-threatening conditions: cancer, positive status for HIV, ALS, Parkinson's, multiple sclerosis, damage to the nervous system, damage to the nervous tissue of the spinal cord, epilepsy, inflammatory bowel disease, neuropathy, Huntington's disease, or as added by the commissioner. Okay, those are pretty serious. And it begins the paragraph by saying severe, debilitating, or life-threatening. Exactly the type of condition which brings out our sorrow and our compassion. But then there's a second subdivision. And I don't know what this subdivision does, because it's just hanging there. It says "and," but it goes, any of the following conditions where it is clinically associated with or a complication of a condition under this paragraph or its treatment. Now, this paragraph, is that just the subdivision 2? Is it subdivision 1? Is it subdivision A? It's very unclear. It's a hole in the bill. Under this paragraph or its treatment: wasting syndrome, severe or chronic pain, severe nausea, seizures, chronic or persistent muscle spasms, or such conditions as are added by the commissioner. in both of these, A and B, it's conditions added by the commissioner. You can't take anything away. And let's deal with chronic pain. What's chronic pain? Well, it's pretty much pain that's persistent, that's anything other than acute. And it's not limited by anything in this bill. And it could be anything the practitioner recommends. I don't know if it was the intent of the drafters or not, but it's here. So it's a hole in the bill. The comment has been made, it's a big change in this bill because we don't have smoking. Give me a break. There's vapor smoke allowed in this bill specifically. It's smoking. No, it's not the use of the whole leaf tobacco or the marijuana plant, but it's smoking. In fact, people have said it's a desirable delivery system. Whatever, it's still smoking. So the illusion that it's not in the bill, I think, is just false. I, too, was visited with parents of great, sincere desire to help their children. And these children actually need help. Epilepsy is really real, and with multiple seizures a day is really, really tragic. This bill is going to be effective in 15 months. Give me a break. We're not helping the people who came to ask us for help. First meeting I had, I wrote to the governor and the commissioner of health and said, you want to do an experiment? You announced it in the State of the State message. Well, take that experiment and work towards the oils that would help the kids who have the multiple seizures. Do something. Let's make it practical. 15 months? It could be even longer than fracking. The last thing I want to say is that there's going to be 5 entities that can have 4 locations to dispense the marijuana. And there's a lot of very tight safeguards in the bill. But I find the most glaring omission is the fact there's no question as to there's nothing provided as to how you will select those entities. There's no bidding requirement. There's no request for proposal requirement. There's no requirement that that be a public process. We don't know how it's going to happen. We don't know where it's going to happen. Who is going to get this? We are doing handsprings about casinos. We're doing handsprings about the rest of procurement in the state. Who's going to be our purveyors of pot? I'm going to be voting against this and recommend my colleagues do likewise. Thank you.